In this video, we're going to discuss some of the long-term problems that you may encounter if you have an atrial switch operation. Now, as a reminder, an atrial switch operation is the correction surgery for transposition of the great arteries. In transposition of the great arteries, your major vessels are reversed. The aorta, which is supposed to come off of the left ventricle, actually comes off of the right ventricle. And the pulmonary artery, that's the artery leading to the lungs, instead of coming off the right, comes to the left ventricle, comes off of the left ventricle. And this is a problem because blue blood never gets a chance to pick up oxygen before going all the way down to your system, including your brain and the rest of your organs. So, the first major type of surgery that was performed to correct this is called the atrial switch. Essentially, blood is rerouted from the right side all the way to the left ventricle, which then pumps it out to the lungs. It picks up the oxygen, it turns red, and it goes back to the right ventricle, which pumps it to the rest of the body. And the brain, in this case, in this configuration, is getting oxygenated red blood, which is exactly what it needs. This was a great operation. However, it is not without its complications. In this video, I want to talk about some of these long-term complications and what we as ACHD doctors monitor for. Well, we can start off anatomically here with the right ventricle. The right ventricle's job is to pump blood out to the aorta. However, one of the major issues is that the aorta has a very high pressure. It's a lot higher than the pressure inside of the lung arteries. The right ventricle was designed to pump blood against the lungs, not your systemic pressure. So it's a little bit weaker, and over time, it can take a bit of a beating. And so it can develop scar tissue, and instead of pumping vigorously, it can be a lot weaker. Now, this can lead to what's called heart failure. And heart failure may be because of poor squeeze. The ventricle is not able to pump as much out, but it can also be because of poor relaxation. Ideally, it has to spring back like a coil back to its normal resting state. And if it's become scarred, it's like it's rusty, it relaxes very slowly. All this leads to backfilling, a pressure increase in the atrium, which propagates backwards into the lungs, down to the legs, leading to symptoms of heart failure, which can include shortness of breath, swelling, particularly in the legs and in the belly. Number 2 is leaky valves. The valve here, as the heart gets dilated, it can stretch and it becomes leaky, which can also lead to heart failure symptoms. Number 3 is arrhythmias. The atria, this top chamber, can get very diseased because of heart failure, but also because of the number of surgeries and all the stitches that had to be thrown in. So there's a lot of scar tissue. This can lead to arrhythmias that are both fast and slow. A typical resting heart rate is somewhere between 60 beats to 100 beats a minute. You can have these aberrant blood vessel cells, these aberrant atrial tissue that form loops and circuits, causing really fast heart rates, which can lead to palpitations as well as worsening heart failure. Additionally, the typical heart, typically the way that the heart contracts is it takes its signals from the pacemaker cells, the sinus node. It's the captain that it transmits electrical impulses to the rest of the heart, telling the heart exactly when to beat. These pacemaker cells can actually get very sleepy if they get damaged, and so the heart rate can actually get low and slow, and that could lead to exercise intolerance or just fatigue and inability to do the stuff that you used to be able to do. Elevated pressure over time can propagate backwards into the lungs, and so the pressure inside the lungs can get high. This is what we call pulmonary hypertension. And then this baffle here, going back through the ventricle, in an atrial switch operation, we rerouted the blood from the veins to the left ventricle using this thing called a baffle. It's kind of like a tube. The baffle can get kinked and it can get stenosed, so it means that it gets narrow. And you may need a procedure where you go in and you stent it open. Additionally, besides baffle stenosis, you can also have a leak. Essentially, that's kind of like a hole that allows blue blood and red blood to mix. If the blue blood gets to the systemic circulation, that will lower your oxygen saturation. So, to summarize, the atrial switch operation took what was once a condition that was fatal in childhood and allowed people to survive well into adulthood. However, there are a lot of complications that can arise the longer that you live. And most of these stem from the fact that the right ventricle is not designed morphologically to pump against the high pressure of the aorta. You can have issues with heart failure, poor squeeze and poor relaxation of the ventricle, leaky valves, fast and slow heart rhythms, as well as baffle stenosis, as well as baffle leaks. It's important to follow up with an ACHD doctor who is familiar with all these complications, is able to monitor for them, and knows how to manage them in the best way possible.